Good morning. Our seminar today about diagnostic imaging in oral and maxillofacial surgery. I will present the part 1 of this seminar as زهراء ماجد as a student at University of Baghdad College of Dentistry 5th stage. Contents: we will discuss introduction about diagnostic imaging in oral and maxillofacial surgery. Then, conventional radiography, which include intraoral radiography and extraoral radiography. Finally, specialized radiography, which include computed tomography, CT, ultrasonography, UG, magnetic resonance imaging, MRI, and cellography. Introduction: oral and maxillofacial radiology, also known as dental and maxillofacial radiology, is that specialty of dentistry concerned with performance and interpretation of diagnostic imaging used for examining the craniofacial, dental, and adjacent structures. First of all, we will discuss conventional radiography, which can be further divided into intraoral radiography, intraoral radiographs, and extraoral radiographs. Intraoral radiographs include periapical radiograph and occlusal radiograph and bite-wing radiograph. First, periapical radiograph. Intraoral radiograph examinations are the backbone of imaging for general dentists. Most frequently used intraoral view radiograph is the periapical radiograph, which shows teeth, periapical region, lamina dura, and periodontal ligament and supporting alveolar bone. Here is the intraoral periapical radiograph, which show teeth, periapical region, and lamina dura, periodontal ligament space, and supporting alveolar bone. Indication of the periapical radiograph in oral surgery: to identify location, depth, and position of impacted tooth, especially third molar. This is the mandibular impacted third molar. We can know this tooth is impacted horizontally by this periapical radiograph. Site and extent of the periapical lesion, like abscess, cyst, tumor, can also identified by using of the intraoral periapical radiograph, like this cyst in this periapical radiograph. Also, we can know the relation of the maxillary sinus to the teeth. Relation of the maxillary sinus to the teeth: this is the inferior border of the maxillary sinus, which related to the root of the maxillary teeth. Also, we can identify the fractured or remnant root pieces. Here, the fractured root of the maxillary central incisors in the periapical radiograph. Also, we can see foreign bodies in the interdental periodontal regions. As we see here, this is maybe remnant of old implant, defective implant maybe in this periapical radiograph. Also, minto-alveolar fracture can be seen in this periapical radiograph. The second is the occlusal radiograph. Occlusal radiograph can be for mandible and for maxilla. Occlusal view of mandible shows a floor of the mouth, lingual aspect of the mandible, lower arch, contour and continuity. Occlusal view of maxilla shows hard palate, contour and continuity of upper arch. Indication of occlusal radiograph in the oral surgery include to locate the unerupted teeth, as we see. Also to localize the foreign bodies in the jaws and stone in the duct of sublingual and submandibular glands. This is called, in this occlusal radiograph, this is called the cyanolyth in Watterson duct. Also to study the hard palate and its lesion like palatal tori and palatal tumors. Here is the palatal tumors. Also to obtain information about the location, nature and extent and displacement of a fracture of mandible and maxilla. This occlusal radiograph of the mandible shows the fracture of the mandible. Here. Also to evaluate size and extent of the pathological lesion like tumor cyst, as this image shows. Bite-wing radiograph is the third. Third is the bite-wing radiograph. Bite-wing radiograph includes the crown of maxillary and mandibular teeth and the alveolar crest on the same form, which means all of these elements will show in the one film. Useful in evaluating the proximal caries, detecting the calculus deposit in the interproximal area, change in the alveolar crest and height, and overhanging of restoration. As we see here, this bite-wing intraoral radiograph, which is one type of the conventional radiograph. This is used for the caries diagnosis, which show the crown of the maxillary and mandibular teeth, also the caries in the interproximal area.